Preet.
Thank you. I wanted to talk a bit about indefinite detention. Can you tell me if the Home Office has identified any links between the scale of drug use in the detention estate and the impact on detainees of indefinite detention?
We don't have indefinite detention, so...
You don't?
No.
Right. And okay, so has any link been identified between... Well, so there's no indefinite detention and self-harm?
Well, we don't have indefinite detention.
Since...
You don't have a limit on detention?
No, but there's no indefinite detention either.
If there is no
But there's
limit...
no limit.
Sorry, Preet.
So, I mean, the proposal has been, I mean, the suggestions have been made by lots of people that there should be a 28-day limit because we are the only country that doesn't have a limit. But so doesn't that mean if we don't have a limit, that's indefinite detention?
We don't have indefinite detention. We will only detain people if we have reasonable belief that we can remove them from the country within a reasonable time frame. So we do not have indefinite detention.
Isn't that slightly a kind of game playing with words? If there
That's
is no
it.
limit, then you have no end, no formal required end to somebody's detention.
Well, the simple fact is we don't have indefinite detention.
But you do have people who are detained for more than a year, for sometimes
There
more than 2
is
years.
a small number of people who have been detained for an extended period of time.
And those people have no finite end to their detention. There is no limit to their detention.
There is absolutely an end in the sense that we will be looking to remove them, or of course that they can return home at any given time.
Well, okay, so if we're, this is playing with words, but so those people that have been in detention for, say, 12 months, have you seen a link in terms of drug use with those people that have been there for a considerable period of time? Do you have the data?
Excuse me, I'll let Patsy chip in as well, but my understanding is that we have not seen a link of that type, a clear link of that type. But again, as I say, people at any point can either, obviously we will be looking to remove them at the earliest opportunity. People themselves in their own volition can leave the country and go back to their home country. At any given point as well, we are, apart from being subject to judicial oversight, they can apply themselves for bail. So there are a number of issues in there that mean that there is no indefinite detention.
So you don't have the data either to support how many of those in detention for 12 months are actually drug using? You don't have that data?
I haven't seen that evidence.
I haven't seen evidence of that. So.
Right. And so...
it's not about whether we've not had evidence of that. So.
Okay. And how many people that have been in detention for, say, 12 months have self-harmed?
I have to say, I haven't seen evidence of there being a link between periods in there and self-harm either.
Okay. So 5 people have committed suicide in immigration detentions this year and over 2,000 attempted suicides. Has the Home Office reviewed its approach to detention in light of these deaths?
Well, we obviously always keep these things under review,
but you said you weren't aware of them, Minister.
No,
you said you weren't aware of any...
We keep our detention systems under review. We've had Stephen Shaw do a full review, and he has actually just started a process of coming back to reassess in light of the review he did. And that process has just started. So obviously we'll look at what Stephen Shaw says when he finishes this current piece of work.
But you haven't, considering some of this has been information we've had since 2010, you haven't, in light of that information, you haven't reviewed, other than asking him to go and review his initial report.
So we have made changes in light of his report. What he's doing now is going back to look at, and I'm not going to prejudge what he says,
right.
To look at how we have and how the system has changed and responded to the findings in his initial report. So,
Minister, can you tell us what those changes have been then that you have made?
Well, there's been a range of changes since the Shaw's original report, some of which do deal with how we deal with vulnerable people in detention, also how we deal with women and children and families. So, for example, we don't keep people in detention who come in some of those categories for longer than 72 hours. So there's a range of things in there, but again, as I say, Stephen Shaw will be doing is doing a review now, and we will report back on that, and that will be in the public domain.
So how do you identify who your vulnerable cohort of people that, say, for example, because you're not agreeing to the term of indefinite detention, have been in your custody, say, for 12 months, for example? How do you make that assessment and judgment?
So everybody who is in detention is subject to regular risk assessment, and discussions happen between healthcare professionals and the service provider in the centre and Home Office and any other relevant party to make the decision. And in fact, one of the measures, as the Minister said, one of the measures put in place after the Stephen Shaw review was the concept of a detention gatekeeper, it's called, to pull that assessment together as part of the adults at risk policy introduced after the Stephen Shaw review. So there's a systematic review that happens on entry and then repeatedly through someone's period of detention.
But I'm really concerned that we've had 5 people commit suicide despite those changes. How are we robustly reviewing that process? Because clearly there are vulnerable people in detention, and with over 2,000 people having attempted suicides, that just shows you the level of vulnerability. So are we being robust enough? Is it effective enough? Is it working? Do we have the right people with the right level of skills, making sure that we're absolutely highlighting who is high risk, medium risk, and we're providing the appropriate support?
Yeah, so I'll see Patsy wants to, but let me just take past that and I'll let Patsy comment as well. I mean, there are a number of those cases are still actually, we're waiting coroner's reports, so I think it would be inappropriate to comment too much on some of the individual cases. You know, any single death in any environment is something that is that none of us want to have. But there will be a range of issues of individual situation time behind some of those cases, and we'll know more once we get some of the coroner's reports back. But I would say that I think every possible step is taken to try and do everything we can to prevent these kind of incidents happening, and any incident of self-harm or attempted self-harm is taken very seriously. And those detainees who are considered at risk of self-harm are identified, they're monitored very, very closely through the multidisciplinary assessment care in detention and teamwork, the system we've got in place. And there are established procedures, as Patsy outlined, to minimise self-harm, including some formal risk assessments on initial detention that are done when people come into detention, citizens raising concerns at any subsequent point as well. But sorry, Patsy wanted to...
No, just in respect of the deaths that have happened in detention, in addition to the role of the coroner, as the Minister said, each one gets investigated by the Prisons and Probation Ombudsman. Because that can take a little bit of time, one of the things the Home Office has done is ask an experienced safe custody officer from the prison service to take a look at the cases and make sure there aren't any quick lessons that we need to learn based on that immediate view of what happened.
Right. And finally, have you considered whether introducing a limit on detention actually reduces the likelihood of removal?
So could you just say that again?
So have you considered whether introducing a limit, because you're saying that there is no, you don't have indefinite detention, would reduce the likelihood of removal?
Well, if you have a short limit on detention, yes, it would remove the likelihood of somebody voluntarily removing, because they would want to just continue. That's why it's really, really important for us to be able to be very, very clear that we will put somebody into detention if they're particularly obviously doing any forced removal, when we have a reasonable belief that we can remove them within a reasonable time frame.
Are you considering then having a time limit?
We are not considering having a time limit at the moment.
Okay, thank you very much.